and we're going to be getting very specific about what kinds of documents that you might need, talking about what you have a conversation with your healthcare agent about. Who do you loop in within your family or even your friends, if there isn't anyone appropriate in your family, to be a part of your care? At what point in time in our lives should we be having these conversations? And how often should we be expecting them to change? There are websites we're going to give you as well to help you out. But joining us now is Dr. Robin Motter-Mast, who is a medical director of primary care and population health at GBMC. She is a chief of staff there, and we're going to be bringing up the information about the slides on your screen right now. She's getting mic'd up right now, but she's going to be talking about choosing a healthcare agent and talking with your healthcare agent about what if. We'll be giving you some information about basic documents that I believe that you can probably go online and download, easy enough for you to fill out at home if you feel you need them, and how to have conversation, who can help you with planning, who can help you making decisions. What if it's all too much? I mean, all of this COVID-19, watching the news, if it's all too much, who can point us in the right direction in a very simple way? And Dr. Motter-Mast joins us now. Thank you so much for being with us.
Thank you for having me.
We got a lot of great information about Gilchrist from Dr. Riley, and we've been talking about the basic services and also functioning during COVID-19. And we talked about advanced care planning and what that means in a broader sense. But I know that you want to talk about exactly who does our advanced care planning, and how do we find initially, is the first thing we do go for a healthcare agent? And if so, how do we find a healthcare agent? And what the heck is a healthcare agent?
Wow, those are a lot of questions. I'm really excited to share some of this information because it is not as difficult as it sounds. And you just had Dr. Riley here, who is such an expert, and we are really lucky to have him here at GBMC. He's been around for years and working on this and working with the community to try to make sure that we all have the people and plans in place when we really need them. So a healthcare agent is somebody who's going to help you make decisions about your healthcare when you are not able to speak for yourself. So it sounds complicated, but it really isn't. And I think most of us today would know who we would want to speak for us if we couldn't speak for ourselves. I think the second part about what we would want them to say is probably a conversation that we need to work on a regular basis. And I hope Dr. Riley shared some insightful information about how to do that.
He certainly did, kind of just how to have a basic conversation. So you're saying our healthcare agent could be a husband or a wife, a brother or a sister, a very close friend, a cousin, anybody who you trust to bring into the situation and to possibly make decisions for you.
It is. Often it is going to be your husband, your wife, or a family member. And it is somebody that you really trust that is going to make the decisions that you would want. So it's important that you have those discussions with your healthcare agent about what it is you do want. But you need that person to be a strong advocate for you. So oftentimes we'll have family members that descend upon a hospital bed at a time when a decision needs to be made, and they bring their own perspectives with them about what these decisions should be. And your healthcare agent really needs to be somebody who's strong and is able to speak up for you and make sure that your wishes are heard over the wishes of everyone else in the room when you're not able to speak for yourself.
Oh my gosh, that can be the worst situation. I've been in it where the family is kind of all trying to deal and everybody has something to say and nobody really even knows what the person who's ill really wants. And so this can alleviate at least maybe some of that, if not all of that. When do we start having that conversation? Do I need to go home today and say to my husband, I want you to be my healthcare agent, just FYI? And what does that mean?
If you did that today, I think that we would have an accomplishment from this video that we're shooting right now. That would be tremendous. So all of us, if really you're over the age of 18, should think about claiming who you want to be your healthcare agent to be and making sure that person knows about that. In the primary care offices, we've been working on this for the last year, and we try to bring it into the conversations when our patients are coming in that are 18 and older and when they're coming in for their physicals. So putting it on the map is something that happens regularly, and not just this year, but every year, So even once you've decided who your healthcare agent should be, you probably want to reevaluate that decision on a regular basis. So thinking about it as part of your preventative health when you come in to see your primary care physician is a great placeholder for a piece of conversation to be had during that visit.
Do you think that COVID-19 is bringing a lot of these topics to the fore?
It sure is, and rightfully so. So we're all afraid about getting sick, and we've heard the horrible stories about people ending up on ventilators and really actually not having visitors that are allowed to be with you when you come to the emergency room and or are hospitalized is really a scary situation. So at this time, more than ever during a coronavirus pandemic, we really need to have some measures in place to make sure that our voices are heard when we can't speak, and we can't speak for ourselves.
You know, it's not funny, but it strikes me interesting that we are more inclined to tell people what we want for our funerals than to tell them what we want before that happens.
That's true, and that's what all of this conversation is about, is starting the conversation and making these type of conversations something that is almost the same as what are we going to have for dinner tonight. So hopefully we don't have, conversations about getting sick on a regular daily basis, but we want it to be part of the community awareness that we all have, and we want to make sure that we do pre-planning. It's just like financial planning that you do and retirement planning that you do. You don't have to be of retirement age to need a healthcare decision maker or healthcare agent designated for you. But we think about these other planning opportunities all the time. Where are we going on vacation? What are we going to do? How are we going to pay down our mortgages? All these things that we do pre-planning for to try to be extra prepared and ready. What are we going to do if a hurricane comes? Do we have the extra water in our houses? So really making plans about what are we going to do if I get hurt and I'm sick and I'm in a hospital bed and I can't tell people what I want. Have we put those plans in place?
This sounds kind of loose when you choose your agent, your healthcare agent. You can tell your doctor about it. The healthcare agent hopefully is aware. But what are some things that we need to actually write down? Or at what point do we need real forms? Is that when we're talking about directives?
So when you talk about an advance directives are really two parts. The first part is who is going to be your healthcare agent. Sometimes we call that a healthcare proxy. Sometimes we refer to that as a healthcare decision maker. And the second part of an advance directive is really what we want to have happen to us when we're in that type of situation. So we're trying to break it up and make it really easy. And we're just saying, tell us. The first thing we want you to do is start thinking about it. Tell us who you would like to speak for you. And then once you've started thinking about that, and you've let that person know, and your family members know that you're thinking about these things, go home and start having those conversations about what it is you would like for them to do for you when that situation arises. So we're trying to break it up, make it easy. The second part of the conversation is more difficult, and I know Dr. Riley spent some time talking about that, but it can be, if you're not in the medical world, it's a little confusing and scary to think about. Do I want to be on a ventilator? Do I need a feeding tube? When do I make those decisions? When shouldn't I make those decisions? But the first part of that conversation about who do you want to speak for you is really a pretty easy conversation. So is it loose? It's kind of loose. I mean, you really do need to write it down, because then it is a legal document, and we have these in the primary care spaces. You can also find them on the internet. You could also print out an advance directive. I think you showed some slides with some resources.
I think we do have a slide of basic documents that might help people with, there it is, and there's some websites too that you can download.
The 5 Wishes document is just a different version of an advance directive that's a little bit more easy to understand for a layperson who's not in medicine. And the MOLST form, we can talk about that later, but that's really a physician's order that talks about what you want. The healthcare decision maker, though, I really want to focus on is just who do you want to speak for you? Let's just start by opening the door and having that conversation. That form is available in the primary care practices, and it's as easy as just write down a name and a phone number of the person that you would like to speak for you. Also, if that person happened to not be available or maybe isn't with us any longer since you filled out your form, it is nice to have a backup and maybe even a backup to your backup. But if you bring that form in and you tell me who that person is, I'm going to witness it and have somebody else in my office witness it as well. And then we put it into your medical record, and it is there. Unfortunately, where we are in society today, there are ways of trying to communicate this information across healthcare systems, but we're still in the infancy of this. So I can guarantee you that if you do it here at GBMC in your primary care practice, the whole hospital system is going to have access to that information. But we are working on how we share that information across the state and then hopefully at a national level in the future.
I'm sure that's difficult with HIPAA, right?
Sharing the information with HIPAA, of course, HIPAA is always something that we have to be concerned with, of how we share your information and who we share it with.
One thing that strikes me, and I see the benefit of making plans, of taking control, but the pushback, and you've probably heard it a million times, is people are afraid to commit because how they feel today might not be how they feel tomorrow, and everything depends on the situation.
That is so true. And the beauty of all of these documents is that they are really simple. They don't require you to have a lawyer. They don't require you to have it notarized, and you can change it whenever you want. So if you do it today and then you change your mind tomorrow, we just fill out another form and it supersedes the form that you filled out yesterday.
Yeah, but what if I fill out a form and then, God forbid, I get into an accident and something happens and I can't change it and I'm committed to it, but yet the situation has, do you know what I'm saying? Like we're fearful of making directives when we really don't know what we're dealing with.
I understand that. I think the thing that we have to get over with the fear is that if we don't take some type of action, somebody else is going to make those decisions for us. So you're really leaving it up to chance about how that decision is going to be made for you. So you can only be as proactive as you can be, and we can't have foresight for everything that happens. But the majority of time when you make that plan ahead of time, that's the direction that things are going to go in. You can't control everything in life, but you can try to do your best by planning ahead and being prepared.
How do we partner with GBMC to get all our ducks in a row when it comes to our health?
One easy thing to do is go to a website, a part of our website that we created. If you go to gbmc.org/advanced care planning, you will find access to several of the documents that you just referenced. Also information about how to have these conversations, conversation starters with your family members. You have access to the healthcare agent form that you can print out and sign. You can send these forms back in through our patient portal called ByChart. So there's a lot of valuable information just on the website. There's a wonderful video that we created that also helps you to understand why this is important and who needs to be engaged in these conversations and how you start to have them.
Have you seen a difference in the responses you're getting from people during COVID just because they are thinking more about what if and their mortality and how life can turn on a dime?
Absolutely. People are more aware and more fearful of what happens, that they could get really sick. But one thing I like to point out is you could walk out of my physician's office and get hit by a car, and that probably happens more frequently at a greater rate than contracting COVID. So we need to think about this as in everyday terms. Just take control of your life and pre-plan the best that you can to make sure that you get the care that you want and that we don't succumb to unnecessary procedures or prolonged hospitalizations, things that you would never want to happen. You really need to take the opportunity to plan ahead for those things and make sure that you get the care that you want, and that your healthcare workers know what that care is.
When you're looking at our situation now that's ongoing and who knows how long it will last, what are some of the challenges you're still facing and you still have placed as a priority to overcome and deal with during COVID-19?
Well, safety in general is something that we're all worried about. So not only in the public is the public worried about safety, but the offices themselves, any workplace is worried about safety. How do I come to work and work in a safe environment? How am I protected from my coworkers? Is everyone in my workplace taking coronavirus and the precautions that have been recommended for coronavirus as seriously as I do? So those are some of the conversations that we have every day. Have we protected our own staff, ourselves, our families when we go home? And are we protecting the patients that are coming into the practices?
I would imagine it's hard to prevent the fatigue that comes with being exactly as safe as you need to be all the time, particularly I think early on, everybody got on board. And now as time stretches on, I think it's easy mentally for everyone to get a little bit lax. So it must be hard to keep that up, the vigilance.
It is. It's exhausting, I think, for everyone. We're all tired of wearing a mask. We're all tired of washing our hands every few minutes and using hand sanitizer. But we realize that we really have to continue to do this. And I hope that we see the benefit because of the actions that we took early on, how we were able to flatten the curve, especially in Maryland. The governor's done a wonderful job at leading the state and helping us to stay under the high rate of some other states. Our hospitalization rate is down again this week. It's great, but we have to stay and be vigilant. And it's exhausting. It is. It's really tiring, but it's really important. And that's how we continue to protect everyone around us, including ourselves.
And do you see also the change, particularly in an older population, possibly the change in the attitudes towards technology because they have to access telehealth and so forth now because of COVID? I mean, it seems like it's kind of, that's turned it for that generation.
I think it's for all generations, and it was coming. Telehealth was coming, and we were having a really hard time pushing it forward because all the insurance companies weren't paying for it, and there were a lot of rules and restrictions about it. We all have very busy lives, and taking time to stop what you're doing, go into a doctor's office, and do a lot of waiting is something that none of us really have time for anymore. So telehealth is here to stay, I believe, as long as the insurance companies continue to pay physicians for providing that service. Elderly patients, and I guess you define the definition of what elderly is something that is really nebulous, and I think we all continue
Depends how old you are.
That's right. We all
it keeps, the number keeps going up and up.
Exactly. Every day for me, anyway.
Right, me too.
But the older patients in the practice really have grabbed onto this just as much as the younger patients have. It's been quite interesting. The rate limiting stuff for telehealth really comes down to Wi-Fi connections. I think it's the same thing that schools are facing when they talk about how we're going to educate our children virtually. It's all about Wi-Fi, and if you have a smartphone or a device that connects using Wi-Fi. So the majority of this country do, at least in the state of Maryland where we practice, the majority of our patients have access to that type of technology and platforms. And the patients that don't, we've been able to do telephone calls with and still treat them over the phone. So we've made huge strides, and I hope that the government continues to allow us to make these strides, because I think that there's even further innovation that could occur as a result of the changes.
Dr. Motter-Mast, these are very big issues that we've been talking about today, really emotionally charged things that we all probably will face at some point in our lives. If you were to leave us with one thing that you hope people, not just me finding my husband to help out with my health decisions, but what, and maybe that's it, I don't know. But if there's one thing you would like people to get to hear you on, what would it be?
Well, now I'm going to sound like a Nike commercial. Just do it. So it really is so easy. Go home, watch the video that we created at GBMC on the gbmc.org, advanced care planning. Google it if you can't remember the website. You can remember gbmc.org. Check it out. There's a wonderful video that helps to talk about selecting a healthcare agent. The form is really easy. Go to your doctor's office at your next appointment, especially if you have chronic illness or disease, and ask them, really, what does that disease look like for me 5 years from now or 10 years from now? What does it mean? What should I be thinking about down the road? And should I have a healthcare agent? And hopefully they say, yes, you should, and here's the form I have, and let me help you complete that while you're here today. So it really is a very simple conversation. Let's just start the conversation and continue to move this concept forward within our community. It's really important, and you're going to be so much happier that you planned ahead.
Dr. Robin Motter-Mast, thank you so much for joining us today. Please be well, and really thanks to you and your staff, particularly for working during this time and helping to keep all of us safe and sane.
Thank you. Thanks. I appreciate it. And don't forget, wear your mask, wash your hands.
I have one right here, which I'll put on as soon as I leave. Thank you so much. And thank you all for joining us today on Greater Living. Until next time.